Myself, Dr. Naveen from Dr. Pinamneni Siddhartha Institute of Medical Sciences. Uh, my title for the platform presentation is a study of severity of COVID-19 in correlation with red cell distribution with neutrophil lymphocyte ratio and platelet count. My guides are Dr. Chakradhar Rao and Dr. Monica. Introduction. Since emerging from December 2019, the severe acute respiratory syndrome SARS-CoV-2 pandemic has caused high morbidity and mortality with new variants rapidly spreading. The severity of COVID-19 disease ranges from asymptomatic to critically severe. Clinical research reported that 10 to 15% of the patients were in the severe category and required a great deal of medical treatment and nursing care. Therefore, the exploration of prognostic predictors for patients with COVID-19 is vital for prompt clinical intervention. Our study aims to explore the predictive value of hematological parameters in the prognosis of patients with COVID-19. Some studies have shown the RDW of patients with severe COVID-19 increases significantly. Recently, studies have reported that neutrophil lymphocyte ratio levels were higher in more severe patients and were suggested to confer a prognostic value in COVID-19 patients. It has also been reported that low platelet counts are seen in severe disease. Aims and objectives. This study was conducted to assess the severity of COVID-19 in correlation with RDW, NLR, and platelet count during the first wave of COVID-19. Materials and methods. This is an observational prospective study conducted on 483 COVID-19 patients, which were admitted in the Department of Internal Medicine, Dr. Peasons and RF during the period of April to September 2020 to assess the disease severity based on oxygen saturation levels at the time of admission. Laboratory markers like RDW, NLR, and platelet counts were analyzed. Inclusion criteria. Patients diagnosed with COVID-19 of age more than 18 years who are hemodynamically stable patients. Saturations were taken as mild above 94%, moderate 91 to 94%, severe below 90%. Exclusion criteria age below 18 years. Results. Out of 483 patients, 320 patients were mild with saturations above 94%, 85 were moderate with saturations 91 to 94%, and 78 were below 90% saturation. There is a significant differences in RDW with p-value of 0.01 and neutrophil lymphocyte ratio with p-value 0.001 and platelet count with p-value 0.0013. This is a pie diagram showing severe, moderate, and mild patients. Out of 483 patients, 321 were mild, 85 were moderate, and 77 had severe disease. This is a bar diagram showing maximum, minimum, and mean values of platelets, RDW, and NLR. This is a bar diagram showing RDW values of mild, moderate, and severe patients. The blue color shows maximum value of RDW, red color shows mild, and green color shows mean value of RDW. This is a bar diagram showing maximum, minimum, and mean values of NLR values in mild, moderate, and severe patients. This is a bar diagram showing platelets, value of platelets in mild, moderate, and severe patients. Discussion. Since the COVID-19 outbreak began in December 2019, there have been many reports on hematological parameters in patients with COVID-19. However, most reports have focused on the differences in hematological parameters in patients with different severities of COVID-19. There are few studies on the role of hematological parameters in predicting the prognosis of patients.